Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to this evening's event. Glad that you have set aside some time to be with us. We're going to look at, I think, a very, very important topic tonight for about 7 to 10 minutes or so. And then I am going to take your questions. Any questions that you have about Medicare or Social Security, I'd be happy to field those questions this evening. So if you want to start actually putting those questions in the chat box, our producer will go through those here in just a few minutes, and we'll get to as many of those as we can during our time together this evening. A couple things I want to mention as we ask you to put questions in. We appreciate greatly if you make sure that we can understand your question. Sometimes people try to be so abbreviated, so concise that I can't exactly answer your question because I don't know what you're asking. So appreciate you trying to be concise, but don't be so concise where I don't understand how I can help you. Okay, and then number two, some of you may need some immediate help, and our switchboard is still open. We are Medicare brokers, so if you need something beyond what I may be able to address with your particular situation, if you want to call in, you can ask for one of our agents, an agent, by the way, that I personally know, that I personally trained and spent a lot of time with, and you'd be in good hands. So feel free to call. There's an 800 number here, 833. You see it there on your screen, 833-3661. And you can tell the switchboard operator that you would like to speak to an agent, and they'll transfer you to someone that can spend really as much time as you need getting that question answered. All right, and then, so if you are new to our company, to our event tonight, we would encourage you, if you'd like to, we'd love to have you join our Facebook group. Have well over 50,000 people in the group, lots of our clients, lots of others around the country, people that are on Medicare and experience things, and other experts that like to weigh in as well. So it's a great place to connect with others, to discuss Medicare, the good, the bad, the ugly. And then also we have a YouTube channel. If you've never visited that before, it is MedicareSchool.com, where we have about 450 videos that are available to you. A lot of those videos I have done. We also have some wonderful content creators within our company that also contribute to the site, but you can go there and learn tons. And we'd love for you to visit that site and actually subscribe, because if you subscribe, every time we put a new video out once or twice a week, you'll be notified of that new content. All right, and so avail yourself of that. And then lastly, some of you may be brand new to Medicare and very intimidated, confused possibly by this whole system. So if you would like to get a very thorough yet brief learning opportunity, I would encourage you to go to our company website. It is MedicareSchool.com, and we have a space there where we call it the Essentials Workshop. And you can actually click on a workshop. There's no obligation. It's totally free to you. And I do a new one every year because Medicare numbers change annually. But you'll learn really lots, the ins and outs of Medicare, a lot of the things you should do and shouldn't do. But I think it could be a very wonderful tool of learning. Again, our website, MedicareSchool.com, the Essentials free workshop. And so make sure that you avail yourself of that opportunity as well. Okay, enough said. Let's get into tonight's topic. We're going to talk about the worst time and the best time for people to go on Medicare. And again, I'll address this just a few minutes, and then I'll start fielding your questions. So I want to talk about, first off, when is the worst time versus best time? And I want to talk about someone who makes the decision to go on Medicare too early. Too early. It would definitely be the worst time if you're in this scenario. Too early means that you're not required necessarily to go on Medicare at 65. Okay, now many of you will. We'll talk about that. But in this scenario, the worst time would be if you shouldn't go on Medicare. Why? Because you or your spouse are still working, and you're covered by an employer-provided plan. And you plan to work past 65, or your spouse is going to work past 65, and you have this group plan available to you, and this group size matters. Okay, so meaning this: if you are covered by an employer-provided plan that has 20 employees on the payroll or more, you don't have to go on Medicare. You don't have to do A, and you don't have to do B. Okay, so some of you shouldn't go on Medicare A or B at 65 if you or your spouse are still working and you're covered by a wonderful employer-provided plan. When I say wonderful, I meaning the price is very good. It costs $200 a month or less for you to be on the plan. It has a very reasonable deductible, meaning probably $1,500 a year or less. you like the network that you're covered by, you're happy with the plan, it has served you well. You could have a spouse that's on the plan that's younger, maybe 60 or 62 or younger, and they're covered by that great plan. And so my point is, you would be making a mistake to go on Medicare at 65 if you or your spouse are still working, and we have this wonderful employer-provided plan. And again, the key is it has to have 20 employees or more. And the reason it would be the worst time, because if you went on Medicare, what happens with large employer plans is if you do enroll in Medicare, what happens, Medicare goes to the second payer position. So you already have great insurance, it's going to pay first anyways. And if you enroll in Medicare A and B, they're going to be in the second payer position, and it's going to cost you at least $185 a month to enroll into Medicare. Okay, that's the Part B premium. And unless you're on Medicaid, you're going to pay that $185 a month. So you just paid $185 a month to be enrolled in Medicare, and Medicare's in the second payer position when you had a great insurance plan. So that would be a mistake to go on Medicare then. So that's really the worst time. Now, I would encourage those of you that do have a group plan that you may hear that you, if you're going to keep working, that you have to take Part A at 65, even if you don't take Part B. Well, that also could be a terrible decision. So the worst time to take Part A is at 65, and you're still working, your spouse is covered by this group plan 20 or more, and you happen to have an HSA called a health savings account. That's the worst time to take Medicare A, would be at 65, because number one, you won't be penalized, because the only people that ever penalized on Medicare Part A are those that have to buy Part A. And folks, that's only 1% of the Medicare population. If Medicare Part A is zero premium to you, which it is 99% of the time, because we paid into the Medicare tax system for at least 10 years, 40 quarters, you'll never be penalized for A. And if you happen to be working, spouse is working, and you're covered by this employer plan that has an HSA, if you enroll in A only, you can no longer put new money into your HSA. Now, your HSA money you have in there is yours, but you can't continue to fund it. And so I would much rather not have anything, A or B, and continue to fund my HSA. Right now, we can put in about $430 a month. It's that's the max on a monthly basis. So I would continue to max out. Don't do A, don't do B. So that's the worst time to take A only, is if you have an HSA. Now, if you don't have an HSA and you're turning 65 and you or your spouse are going to keep working, you have a good group plan 20 or more, then it is fine to take Medicare A only. Only those that have HSA should not take A only. The rest of you, I would take A only, but I wouldn't take Medicare B. Again, that's the worst time to take B. Why? Because B is going to be in the second payer position, because 20 or more employees on the plan, your group plan is going to pay first. And so don't take B. All right, so that's the first worst option, is to take Medicare too early. The second worst option would be to take Medicare too late. All right, and so anyone that, when I refer to being late, I mean those of you that should start Medicare at 65. If you don't, and sometimes people make this mistake, there are actually 5 groups of people that must start Medicare at 65. If you don't, and you start later, you're too late. So that's the worst time to come in. So the best time for you to come in, if you're in one of these scenarios, is at 65. And that would be anyone who's no longer working, or your spouse is no longer working, meaning you have no employer option available to you. So the best time to take is now at 65. If you are covered by COBRA insurance and you are turning 65, the best time for you to take Medicare is at 65. And the reason for that is because if you're covered by COBRA insurance, that COBRA insurance company, whoever it is, could be Blue Cross Anthem, could be Aetna, could be United Healthcare, whoever it is, trust me, at 65, if you're on COBRA, that insurance company is going to move to the second payer position. And so it is in your best interest to take Medicare A and B at 65. If you do plan to keep COBRA, it's fine to keep it for a while, not too long, but for a while, you have to enroll in a Medicare A and B and put Medicare in the first payer position, because COBRA only pays second. So if you only have COBRA and you're turning 65, then you will be the first payer and COBRA is going to pay second. All right, the third scenario would be anyone that is covered by what's called TRICARE insurance. Now, TRICARE is for those that are retired military, not that just served in the military. That would be VA eligibility. I'm talking about TRICARE. You retired military, You were in for 20 years, maybe 25 or 30 years, and now you have TRICARE. So what happens, TRICARE is just like COBRA. It covers first payer until you turn 65, but at 65, it goes to the second payer position. So you're on TRICARE. You are going to make a mistake if you don't enroll in A and B on your 65th birth month. Okay, so that's the third scenario. Fourth scenario would be anyone that is still working, but you're not covered by a large plan, you're covered by a small employer plan, and that is 19 employees on the payroll or fewer. Again, that's a small employer plan, and Medicare says you must put A and B in the first payer position because that small employer is no longer obligated to pay first, it pays second. And so if you don't enroll in a Medicare A and B, and small employer is your plan, then you become the first payer. And then lastly, the worst time to come to Medicare would be anyone who is covered by an Affordable Care Act plan that doesn't cancel that plan and go on Medicare at 65. Okay, you should go on Medicare at 65 if you're covered by the Affordable Care Act plan, which meaning you went through the healthcare exchange or a broker or someone that helped you get that underage policy. Now, the reason that ACA plans are favorable for most people is because they're incentivized, tax subsidies, reduced premiums, cost sharing paid by the federal government. So there's a lot of financial incentives that make ACA plans attractive for many, not all, but many. And so if you are on an ACA plan and you turn 65, what happens is all the financial incentives are gone. No longer will you get tax subsidies, there's no cost sharing, you'll pay full premium. So there's no reason, folks, to stay on an ACA plan, the Affordable Care Act plan, at 65. Because the incentives are gone. So you are going to go on Medicare. So the worst time for you to go on is later. You want to start at 65. Okay, so that's kind of the worst time and the best time. Now I want to give just a real important caution. For those of you that are already on Social Security, in other words, you're receiving Social Security benefits, it could be retirement or spousal or survivor benefits, widow or widower benefits, what's going to happen is you're going to be automatically enrolled into Medicare at 65. And you're going to get your Medicare card about 100 days, 3.5 months prior to your birth month. You're automatically enrolled into Medicare, and they're going to mail you the card. And so what happens is a lot of times people don't know what to do when the card comes. Now listen, if you have to go on Medicare at 65 because you're in one of the 5 scenarios that I just talked about, meaning you're no longer working, your spouse is no longer working, we're covered by a small employer, we're on TRICARE, we're on COBRA, we're on an ACA plan, then you are going to keep your Medicare A and B enrollment. You're going on Medicare at 65. But if you're on Social Security and you're on A and B, but you or your spouse are still working and you have one of those good employer-provided plans, great premium, great network, great coverage, the premium is less than $200 a month per person, then you are going to make a mistake, in my opinion, if you go ahead and keep Medicare B. Now, you're on Social Security, so you have to keep Medicare A, but you don't have to keep B. So what I would recommend in that scenario is mail your Medicare card back in. You check a box on the back of the card that says, I do not want medical insurance, which is Part B. Send the card back in, and they'll send you back a new card that'll say Medicare A only, and then you can pick up B at a later date when you drop or lose that employer-provided plan. You can come in at a later date, no penalties, no problems, okay? And so the point is, the worst time for you to go ahead and have A and B is right now at 65 if you're on Social Security, but you're still covered by that employer-provided plan. Just because they automatically enrolled you doesn't mean you have to stay on Medicare B. Mail the card back in, drop off B, and pick it up at a later date. The key to coming into Medicare after 65 is all we have to do is prove that we've had employer-provided plan, someone was working, you or your spouse, and you're covered by a group plan. We just have to verify that all the way back to 65 with no gaps in coverage, and you can pick up B at a later date, all right? And so those are the worst times and the best time. Some of you need to start at 65. That's the best time. Some of you should not start at 65. That's the worst time. All right, now some of you, if you put it off when you should be starting at 65, then you're going to make a mistake, and you can come in at a later date, but there will be penalties and there will be problems. All right, so hopefully that's helpful. Daniel, I am ready for questions, and anything you want to ask now, please put in the chat, and we'll get to as many of these as possible. All right, first question, and I need a drink real quickly. All right, can you please explain a bit about how you and all the other companies that are popping up on my Facebook feed God Love AI, are paid for the invaluable service advice you provide? That's a great question, John. So what happens is the entire insurance industry, whether you're getting auto insurance, life insurance, health insurance, homeowners insurance, all of it is based upon an agent that will actually give advice, provide service to help you make your insurance decision. Hopefully, if they're ethical, they're going to have your best interest in mind. But my point is, insurance plans have to be written by someone that's licensed in that state, certified to sell the product, and we have to go through, of course, continuing education and all that kind of stuff on an annual basis. But what we do is we write these plans. The insurance company provides the coverage. The insurance company sets the premium, but we write the plans. And when we write those plans, regardless of who we write them for, that insurance company actually pays us a commission. And so that's how we pay our bills. And so, again, any form of insurance has to be written by a licensed agent in that state and certified to sell that product. And when we write that piece of business, that insurance company then, again, is going to pay us a commission. So that's how it works. And I will let you know that regardless of, let's say you decide to use our company as a broker, or you went to, Joe Blow down the street, or, a friend, or whoever you went to, that agent is going to be paid by the insurance company, not by you. It's actually illegal for an insurance agent to actually receive a commission as well as charge an applicant a fee. So it doesn't work that way. So we truly are at no cost to you. Everyone is, because insurance companies will actually pay us. Okay, so that's what's going on. It's a very competitive market. I would tell you this, there's two types of agents. There's captives and they're brokers. We're not captive at MedicareSchool.com. We're brokers. A captive agent means they work for one company representing that company's portfolio of products. And sometimes that product may be wonderful. But as brokers, we know that one size doesn't fit all. So we don't just write for one captive company. We write for multiple carriers because we're trying to find out what is in the best interest of the client. It may be ABC Insurance Company, it may be XYZ Insurance Company. But if I only write for ABC, that's all I can talk about. And so we prefer to talk about multiple companies, multiple options with the people who choose to do business with us. All right, great question. Let's keep going. Okay, Hawkeye, tell me the best thing for Medicare and VA healthcare coverage together. Okay, so Hawkeye, as long as you are happy with the VA system, meaning this is someone that knows their VA eligibility, they know how much VA is going to cover, sometimes that's 100%. They're familiar with how that coverage is going to work, they're close to a VA facility and all that, meaning they like the VA system. If someone likes the VA system, then what I would do if it were me is I would enroll in Medicare A and B, and then I would set it up so that I would have a civilian option. And the civilian option at the lowest price to you, why? Because you may not use it often, would be a Medicare Advantage plan. And so my point is, many people that are in the VA system enjoy having another option outside the VA. And the least expensive way to do that is to roll into a zero premium Medicare Advantage plan. And we call those Medicare Advantage only plans. I would get all my prescriptions to the VA, but I would have this civilian option called an MA only plan. And all the big insurance companies offer these. And so what that does is that gives you an option to go outside the VA for everything but your prescriptions, to see a doctor, to have a surgery, to get a second opinion. And the beautiful thing about that is in the present system is that when you enroll into one of those MA only plans, that Medicare Advantage company actually will give you a credit towards your Part B premium. Part B premium right now for most people is $185 a month. Now, if you're on Medicaid, Medicaid's going to pay that. But if you're not on Medicaid, then you're going to pay that $185 a month. It comes out of your Social Security check, or they will bill you on a quarterly basis. And so what the Medicare Advantage company does, because they don't have to cover your meds, is they actually give you a credit towards your Part B premium. And sometimes that's $150, $175 every month. So you actually can get that set up very, very well to have that wonderful option outside the VA system. Now, if you don't like that, you can always drop your Advantage plan in a year during the Medicare open enrollment season. So it's not like a lifelong decision. So that's what I would do if I like VA and I have a facility close by, I'm very comfortable with that system, I would not get a supplemental plan. Now, if you said to me, I don't like the VA, I'm not happy with that system at all, well then my answer would be totally different. Then I would look at both of my options for Medicare. I would look at original A and B with a supplemental plan, G or an N plan, or I would look at just a straight MAPD plan, Medicare Advantage with prescription drug coverage included. So that's what I'd focus on if I didn't like VA. But if I like VA, again, I would do an MA only plan. Again, it's not lifelong. You can change those on an annual basis. All right, let's keep going. All right, William, you mentioned formulary exceptions before. Will plans actually add a super expensive drug to a plan, assigning it to a Tier 5 status? Why would they take on this huge added liability? Well, if they do add it to a formulary, William, it's because they are required to. Okay, so let's go back and answer the first question, though. So a formulary exception, for those of you that are new, is this. Whenever we have a Part D plan, if I have A and B with the supplemental plan, I have a Part D plan that is called a standalone plan. It's a separate Part D plan, a plan I picked out based upon my meds, my pharmacy choices, and there's a premium applied to that plan. Sometimes they're very low, even zero, but again, it's a separate plan from A and B and my supplemental plan, separate standalone plans. If I take a Medicare Advantage plan and I'm not going to get my meds to the VA, then I will have a Medicare Advantage plan that embeds a prescription drug plan. That's called an MAPD. And so what happens is they give us a formulary. A formulary is nothing more than the list of medications covered by the plan. And what he is saying is what happens if there happens to be a medication that's very expensive that is not in the formulary that is offered to me by the company. Well, if that's the problem, you need a medication and it's medically necessary, then you can ask for a formulary exception. It's not covered by the plan for all beneficiaries, but you can ask them to cover that for you. And so your doctor fills out a form or you fill out a form and you send that to the insurance company asking them to add that to your formulary. Now here's what happens. The majority of times they're going to approve it. Occasionally they may not, but usually they do. Or what they may say is, no, we're not going to cover that initially because we have some, generic equivalent or generic alternative meds that we want you to try first. That's called step therapy. So sometimes we have to jump through the hoops before they'll fill that brand name medication. And so if they assign it a Tier 5 status, that just simply means that you're going to have to pay a higher copay. It could be a percentage of the cost of medication. But here's a good thing, folks. Remember this. Even if this happened to you, Medicare prescription drug plans have a $2,000 annual cap. So even if it was a $5,000 a month medication and you had to pay 25% of that, which in my example would be what, $1,250, the most you're going to spend for the whole year is $2,000 out of your pocket. So if they do add that to your formulary and you hit the $2,000 max, you'll be zero for the rest of the year. So it could be problematic. You're disappointed that you had to pay $2,000, but I can assure you, if you're on a medication that retails for $5,000 a month, you'll gladly pay $2,000 once for the whole year, and then you're done. All right. So that's how it works. Whenever we have to have and ask for a formulary exception, and the reason, William, where you're saying why would they take on this added liability? Because they have to. Now, I'm not saying they're obligated to cover every single medication, but they're supposed to cover meds in every single disease category. They usually have 2 in formulary. So if it's not there and you need it, they will probably add that to the formulary for the year. And that doesn't mean they're going to cover it next year, but they're going to cover it for that planned year. All right, great question. Let's keep going. All right, Ken, does the out-of-pocket maximum reset in your birth month or in January? Yeah, it resets every January. Drug plans are calendar year plans. And so if you're start a plan in July, then that 2,000 max is between July and January 1, and then it's going to reset again. And then again, if you hit the max, you're done for the year. So resets every January. And that's the same way on Advantage plans as well, because they have a max out of pocket that's separate from the Part D max, and it resets every January also. All right, Daniel, who's next? What are your thoughts on the proposed cuts to Medicare and how it might affect us as we are starting this journey? Okay, Tim, well, first off, there is nothing at all definitive about the Medicare cuts. Now, I've read the headlines as well, $500 billion and all that kind of thing. So what happened is this. The legislative laws say that whenever there's going to be an increase to the federal deficit, which this new bill that's being proposed, that's passed the House, but not yet the Senate. But the point is, anytime there's going to be an increase to the deficit, there automatically has to be a 4% reduction to other government agencies. And that percentage is 4%. So if you take the overall Medicare budget and you multiply that 4%, that's how they're coming up with that $500 million or $490, whatever it is. And so, but you'll notice that they're not talking about any details to how Medicare is going to be affected by that 4% decrease. And the reason for that is because Congress has the right and has exercised this right ever since it became law back in 2010, where they can say to the executive branch, but you don't have to necessarily enforce that, okay? So that's why there's no details yet about the impact of that 4%. And so might it happen? Sure, it could. But again, this thing's been going on forever, ever since this 4% automatic reduction came into existence when they passed the ACA law. It's been there, but no executive branch has ever implemented that. I'm not saying that the Trump administration will not, but again, we don't have any details whatsoever about that. Our gut feeling is, because Trump has said he didn't want Medicare being affected at all, I doubt they're going to impose that 4% reduction upon Medicare. Now listen, if they did, I would suspect that they would spread that out over all the different parts of Medicare. I'm assuming it would affect Advantage plans, it could affect maybe physician fees. I mean, there's a variety of ways that they could take that and spread that out. Okay, so at this point in time, I'm not minimizing your concern, but I would tell you at this point in time, no reason for us to even speculate that that's even going to happen, or actually how it would happen if it does. Okay, great question, Tim. Thank you, sir. Keith, I have a United Health HMO Advantage plan. I'm moving from California to Wisconsin. How long do I have to make adjustments? Okay, here's the way it works. Once you have a move date, you can actually change your Medicare Advantage plan 30 days before the move date and 60 days after the official move date. Just yesterday, I had clients move from Kansas to Colorado. They were on supplemental plans, so they didn't change their subs, but they did change their drug plans. And so what we did is their official move date is June the 5th. But they called in, they know that everything is set up, and we went ahead and changed their Part D plan yesterday for an effective date of June. So the answer is 30 days before the move date, and then within 60 days after the move date. Now, I'm going to share something with you. Keith, when you move to Wisconsin, Wisconsin is like Minnesota and Massachusetts. Those are called waiver states. They have their own types of plans. Now, again, they'll have Advantage plans there. So if you want to move from Advantage to Advantage, number one, we'd love to help you do that. We were at a lot of business in both of those states, actually, but we can help with that move. But another thing that you have is you have the right to also get a supplemental plan with no underwriting, because you're leaving a Medicare Advantage in California and going to Wisconsin on a supplemental plan. So that's something else that you could consider. But if you'd like some help making that move and setting all those plans up in your new state, we'd be delighted to assist as your broker. Okay, let's keep going. Rick, are you legally required to go on Medicare even though not doing so would be financial suicide? Okay, no, you're not. The only Medicare you're legally required to be on would be Medicare Part A if you're on Social Security. Okay, that would be it. It's not really a legal issue. It's just the way the system works. Anyone that's on Social Security is going to be automatically enrolled at A and B, but they don't have to keep the B, but they have to keep the A. And so again, it's a zero premium, so it should be no big deal anyways. But no legal requirements other than Part A. Now, if we don't take B and we don't take D and those kind of things, we're going to be subject to penalties down the road. Like you say, it would be financial suicide, but there's no legal requirements to do that. All right. Okay, does selling your primary residence and you're on Medicare A and B end up costing you more on your Medicare B payment? For example, your profit on the primary residence would be $300,000 to $400,000. Okay, well, let's say this. They call this an exclusion. So if the profit is $300,000 to $400,000 and you're married, then you still wouldn't be penalized as long as you qualified for that exclusion, which means this: in the last 5 years, you had to own the property for at least 2 of the years and occupy it for at least 2 of the years. Okay, and a married filing a joint return has an exclusion of $500,000. Now, if you're single, that exclusion is $250,000. So if you are single, and again, you meet the exclusion requirements, occupied 2, lived in it 2, those don't have to be simultaneous in the last 5 years, then that maximum is $250,000. So if you made $400,000, then the amount above that in that example would be $150,000 that would be considered as a long-term capital gain, and that would then impact your Medicare Part B. So again, $500,000 married couple, $250,000 for a single. Anything below those numbers, there's no impact at all in your Part B at all. All right, let's keep going. Okay, started my supplemental NG last year, and I healthcare premium locked in for a year, $140. This month, my premium increased $179. This means an annual increase. Okay, all right. Well, obviously your premium didn't go up that much. I would tell you this: that is kind of on the higher side for this year. Now, it's not the highest. I've seen some as much as 40%. Not the most common, but again, I've seen it. I would say right now, average is movements about 10 to 15%. So that's what I'm saying. You're kind of in the middle there. Disappointing for sure, Stephen. But I would not say that you should expect this to be an annual increase. I would tell you in the past, until the last couple of years, United Healthcare has been on the average of about 5%, maybe 7% on the high side. So very, very stable company. What has happened is we experienced a tremendous amount of medical inflation. Plus, during the COVID years, people were not utilizing services at all, and that kind of kept premiums very stable and low. And then all of a sudden, after COVID, now people are back to high use of services, and that's why we're seeing these increases that we're seeing. But again, not the norm for UHC. Painful, I know. Now, I would tell you this, Stephen, if you want to call us, and you can call in right now, we could talk about possibly putting you on a different supplemental carrier, maybe moving to an in-plan or staying with the G, but with a different provider. And we could go through that process with you. May have to go through underwriting to do it, but we'd be happy to shop that for you to see if it may make sense for you to move. But again, not the norm for UHC. It's your norm for sure, so I hate that it happened to you. So if you want some relief on that, need a relief, give us a call and let's see if there may be some other options for you. Not knocking down healthcare at all. We write lots of business for them, but there's a lot of companies we write for that have not had these sizable increases that you may take advantage of. Okay, let's keep going. Sarah, I have cancer, need hearing aids. Which is the best supplement, and does it pay for hearing aids? Okay, first off, Sarah, on this program, I do not really talk specifically about better companies, best companies, and all that. So I cannot get into that. We really are an educational platform. And so we certainly write plans, and I'm very familiar, and I could answer your question specifically. But what I want to do is I want to make sure you know that I'm really not going to recommend anything. First off, I'm sad for you that you have cancer. I sure hope that your treatment is successful. In regards to needing hearing aids, and again, I don't know your status right now, but if you can, I definitely would recommend getting a supplemental plan. I think a supplemental plan is going to give you better options, more options for doctors, less hassle for pre-authorization. So if you can, I'd get a supplemental plan. And then what you can do is you can buy a separate plan that we call dental, vision, and hearing. Dental, vision, and hearing, DVH plans. Now, many of them have minimal benefits on the hearing aids. You'll get a little bit. But the one I've seen recently, and again, I am not promoting this you, I'm just saying to you, in your situation, if you need hearing aids, I would look at Cigna's DVH plan. And because I think of all the standalone DVH plans, it looks like to me that covers hearing benefit better than the others, okay? I'm not saying that those are bad plans, I'm just saying to you, that's one I'd be looking at in your scenario. That's if I had A and B with a sup, and you don't have to have your sup with Cigna, but you could do a standalone Cigna dental plan. But again, I don't know where you live, and so it varies state to state, but I would look at that as an option, okay? Secondly, if you're not going to get a supplemental plan, then what I would do is you can go with an Advantage plan that will include hearing aids. Now, they vary. Sometimes a plan will say you have to use our network, and if you buy this level of hearing aid, you have a $400 copay. this level of hearing aid is $800 copay. So it varies. Another one may say we'll give you a credit for your hearing aids per ear, maybe $1,250 per ear or $1,500 a year per ear, and you can go that way. So if you get an Advantage plan, they almost always embed a hearing aid benefit. In other words, it's part of the package. So if you go with an Advantage, I'd be paying attention to the network. Number one, try to get a PPO if you can, especially with cancer. Just going to get a larger network. And then make sure you look at the details of their hearing aid coverage. Okay. Again, I like supplemental plans. I think Advantage plans are fine. But what I don't like about Advantage, or I don't like pre-authorization. I don't like the fact that the insurance company has any say-so. I don't like them having the final say-so. I hate that. I would rather Medicare and your doctor make all the rules and decisions, not the insurance company. And that's what's happened. That's what happens on A and B with your supplemental plan. I also like the fact that supplemental plans are lifetime. I don't know what kind of cancer you have, but I hope you fully recover. But there could be a period of time when you couldn't qualify to get a supplemental plan. So if you're new to Medicare, you have this opportunity 6 months of your B date where there's no underwriting required. So that's a wonderful time for you to get a supplemental plan. And it's a lifetime policy that can never be canceled. So I like that. And plus, I don't care if you live in Florida, you live in Alaska, you pull out your A and B card and your supplemental G card or N card, whatever you have, coverage is the same. There's no difference. When you pull out that Advantage card, we just don't know what's going to happen, depending upon where you are. And so you could have some issues and some problems. And so I'm just saying to you, Advantage plans are not bad insurance, but they come with a few kind of aspects of their coverage that I'm a little bit uncomfortable with. Now, if you say, hey, Marvin, I can't afford a supplemental plan, then don't try to get one. Get the very best Advantage plan that you can in your area. And that depends upon your doctors and your needs and all that kind of stuff. And we'd be delighted, Sarah, to help you with that. If you want to give us a call, we could walk you through that process. All right, let's keep going. All right, Dean, are chemotherapy drugs considered prescription meds by Medicare, thus subject to individual company drug formularies? No. No, traditional chemotherapy is going to be covered through Medicare Part B. That's the outpatient side of Medicare. And so if you have a supplemental plan, not only is B going to cover 80% of that chemotherapy, but your supplemental plan, after you've met your deductible, is going to cover the balance of that 20% coinsurance. Now, if you decide to go with an Advantage plan, then the Advantage plan is also going to cover the 80% like original Medicare would, and then you would be responsible for most Advantage companies. You'd be responsible for that 20% coinsurance until you hit the max out of pocket. So it's not covered by drug plans. The only kind of chemotherapy that would be covered by drug plans possibly could be if someone is taking self-administered chemotherapy pills. And my understanding is whenever we have a chemotherapy medication that's traditional that has a pill equivalent, that can still be covered by B. But if there's chemotherapy pills that don't have a chemotherapy equivalent, traditional, then that would be covered by the drug plan, or at least we have to make sure if we're taking it, it would be covered by the Part D plan in the formulary. That would be the difference. Okay, let's keep going.
It's a multi-parter here.
Oh, I'm sorry. Another part of your question. Mary. I got you. Okay, Mary. Husband, 65, went on Medicare and B, February, April 2025. Went on Medicare A and B, February, April. Okay. Was on my public school, maybe something, retirement work plan, but he chose to take a Medicare supplemental drug plan instead. Okay. Hang on just a second. I want to make sure I'm clear on this. Husband went on Medicare A and B when he was supposed to at 65. Retirement work plan, but he chose to take. Okay, I got that then. I understand. Okay. We're recently went back to work. Okay, now I'm clear on that now. I'm good. Let's keep going.
He recently went back to work.
Goes back to work. Now what? Okay. So during open season gets a work for 2026, would he be able to cancel sub-drug plan for, okay. And the answer to that is yes, as long as that plan, and I'm sure it is, PSHB, has 20 employees or more, then he actually can drop his Part B, he can drop his supplemental plan, and his drug plan. He has to stay enrolled in Part A. Once we've enrolled in Part A, we cannot disenroll from that. So he can drop all that, no problem. Secondly, when he finally retires, would he be able to return to a Medicare? And the answer to that is yes. Here's the key, Mary. So I am assuming that up to this point in time, since 65, he has been either covered by Medicare, I mean 65th birth month, he's been covered by Medicare A and B, or he'll be covered by an active employer-provided plan, because we can have no gaps in the coverage. So when he makes that transition, he needs to stop his Medicare 12/31/2025 and start his work plan January 1, so that if he works 2 more years or 5 more years, when we go back through and verify, we have to make sure there's been no gaps in coverage of active employment or Medicare coverage, and then he'll have no problems whatsoever. And where people get themselves in a problem is when they transition jobs and they're going to go without coverage for a month or two, and they go on COBRA. COBRA is not considered credible coverage. You hurt yourself in that scenario, but as long as he has either Medicare or active employment provided, no gaps in coverage, I promise you he'll have no problems whatsoever. Okay? And then what I would do for sure is make sure that his group plan is better than Medicare. So what's it going to cost him to be on the plan? What's his deductible? All that. So look at the cost of that and compare that with the Medicare option. Sometimes Medicare still beats employer plans. I see it happen all the time. But if it's a great plan and they're covering most of the cost and it's low deductible, then he can do exactly what you're asking me about with no problems.
Speaking of COBRA.
Okay, I'm 71 currently on Social Security since mid-2024, but still use COBRA for medical based on my old company's plan. What are my options? Okay, well, here's where you stand. I would have to know when your old company's plan, let me say it this way, when you stopped working. Okay, so if you stopped working within the last 8 months, you are fine. You can pick up Medicare Part B, because once we lose active employment from that month for the next 8 months, we are in what's called an SEP. And that's called a special enrollment period. And what we'd have to do is verify that you have had coverage in the past by the employer or employers back to 65, but we have 8 months from when that last employment ended to do this. Now, if you are telling me that you are beyond the 8 months, you have a problem. Now, you have actually 2 problems. Right now, your problem is if you had a large claim, your employer, your COBRA plan is only going to pay second. You are going to pay first. And a lot of people don't realize that. So I hope you're not stuck. Okay, so hopefully you're still within 8 months of when that employment plan ended. But even as it sits today, if you're still within 8 months, I would be moving on this real quickly. I would want to start my Medicare Part B June 1, because I promise you, you are in the first payer position. Now, I know you have A only for sure, because you're on Social Security. But if you don't have B, then you're the first payer on anything outpatient or doctor related, because that COBRA is only going to pay second. Now, if you're beyond the 8 months, you're in a real pickle. And the reason for that is because now you're going to have to wait to pick up Part B until next year. And so you will enroll during what's called the general enrollment period, and you will enroll in Part B in January for a February 1 start date. And again, I hope that's not what you have to do. Again, your COBRA is only going to pay second on the A side and the B side. So your position you're in right now with no Part B, you're the first payer on the B side. So any doctor visit, you pay first. If you had a surgery, you pay first. Anesthesiologist, you pay first. Emergency room, you pay first. So anything on the B side, you're in the first payer position. So get on Medicare if you can, June 1. Give us a call. We'll help you walk you through the whole process. Otherwise, you can start it next February 1. Again, you have to enroll in January to start February. All right. Call us, and we'll make sure you're doing the right thing. Okay, certain Part D plans have drug quantity limits. Yep. For example, 30 and 30 days. Does that mean I have to pick up my prescription every 30 days? Okay. Yes, it does. If you have a quantity limit on any medication, that's the most pills that can go in that bottle. And so what's interesting about your scenario is that I usually see Tier 3, 4, and 5, where we have quantity limits of 30 and 30 days, so just one a day. I believe you, so I'm sad that's happening on a generic. But if that's what it says, then that's all you can do. Now, as far as picking them up, You could also do mail order. Sometimes mail order is even a better price. Not always, but sometimes it is. So if that's a hassle for you, I would take that and call the Part D plan and try to get that on just a mail order so it's not a hassle every 30 days. But most of the plans, unless there's a quantity limit, are happy to, and they prefer to, cover meds on a 3-month fill. But again, if it's addictive or expensive, that's not going to happen, and obviously that's your case. All right, so I would stay on a Part D plan. Let me tell you why. Even though your meds are cheap right now, what happens in a month from now, you have some serious, let's say you had an AFib and you had to be on Eliquis. That's $600 a month. And so what's going to happen if you didn't have a Part D plan, you're going to pay full cost. With the Part D plan, you're going to pay about 25% of the cost of medication. And then once you've reached a total out of pocket $2,000, you're done. But if you drop that Part D plan, you have no maximum. And so please don't drop your Part D plan. Stay on the Part D plan. And then you may switch next year, to get on a better plan, maybe one that wouldn't have a quantity limit on that medication, but keep your Part D plan for sure. It's too risky to go without because, yes, your drugs are cheap now, but that could easily and quickly change. All right. Generic, my friend has Plan G with Mutual of Omaha and is unhappy with their service. As long as she stays with Plan G, can she switch to another company? It just depends on where she lives. There are actually 16 states where she could possibly make that move, either around her birthday or around the policy anniversary date. All right, and so again, just depends on where she lives. Those are called birthday rule states. Missouri, it's called the anniversary rule state, and those rules vary. But most of the states that have those, she can either move from a G to a G, like to like, or G to an N with no underwriting. Now, if she is healthy, she can move anytime she wants. And so I would just have her call in and we can go through the list of those birthday states. She can make that move at a certain time. But again, as long as she's healthy, she does not have to stay with Mutual of Omaha. And I know they've had some pretty sizable price increases lately as well. Sad to hear there wasn't good customer service. I don't think that's the general rule of Mutual of Omaha. I think they have a good reputation, but you never know who you're going to get on the phone. So that does happen for sure, probably with most companies. But again, if she would like some assistance with that, we'd love to help her make sure she makes the right move to the right company and improve her situation. All right. Okay, I have an appointment with one of your staff tomorrow about which is better for me, N or G. Mine, G, is quite up a bit. Thank you so much. Love being one of your, okay, good. All right, well, whoever you call into, I personally know, number one, I hope that you have a good experience. If not, let me know about it. But we get really great reviews. So I sure hope tomorrow you have a great experience. And by the way, I don't think it's a mistake moving from a G to an N if you're going to save some substantial money. Obviously, you're going to take on a couple copays that are reasonable and excess charges if and when they occur. So I don't think you're taking on a big risk when you move from G to an N. I don't think that's a bad move to really consider. So hopefully things will go well tomorrow. Thanks for allowing us to serve you. All right, we're looking. I'm going to take a drink again. Okay, and the answer, Colleen, is no. Is there an issue if you have no insurance for the year prior to my 65th birthday with getting on Medicare at 65? No. No issue whatsoever. Now, there's definitely an issue if someone goes without insurance after 65. There's lots of those, but no. You can start your Medicare A and B. You can still start a supplemental plan or an Advantage plan on your 65th birth month. All your pre-existing conditions will be covered. You don't have to worry about that, okay? In that scenario, again, I'm not saying across the board, but when you first go on Medicare, you're in a period of time where there's no problems whatsoever, okay? And so if you need a broker, give us a call. Why stay on COBRA as secondary moving to Medicare? Okay, well, the only reason someone would do that is if the COBRA coverage is paid for completely by the employer. Only reason. Second, there's a lot to this. Second reason would be if you have found out how your COBRA plan is going to coordinate with Medicare, meaning if Medicare pays first and they pay second, they pay well. Maybe they'll cover everything. I don't know. But if the price is right, the coverage is good, then we can keep it for a while. But we would never keep our COBRA coverage more than 6 months beyond our Medicare B date. Because if I keep it beyond my 6 months of B date, now to get a supplemental plan, I have to medically qualify. So again, the majority of people, you're not going to stay on COBRA. But you're asking me, why would somebody? And there's a reason. If it makes sense financially to do so, but never more than 6 months. So let's say I start my A and B this month, the month of May, and I'm on COBRA because it's paid for 100% by my company, and it picks up everything that Medicare doesn't cover. Okay, that's wonderful. But I'm not going to keep it beyond watch. 6 months of my B date. So that would be May, June, July, August, September, October. So I'm going to enroll into a supplemental plan effective November 1. I'll do that sometime in August, September, something like that, because I'm not going to stay on my COBRA more than 6 months. Now, let's suppose that you have a spouse or children that are also covered by that COBRA. Well, COBRA can be 18 months or 36 months, depending upon your situation. So sometimes what will happen, you have a younger spouse that needs the COBRA or children that need the COBRA, then what will happen is you'll still keep the COBRA. Okay? Why? Because they need it. Now, you're not going to use it beyond the 6 months of your B date, but they are. Because it'll still pay for their coverage. So sometimes people need to do it for that reason as well. So a lot goes into that. And again, the normal answer to that question is you're not going to. But I have seen scenarios when it made sense for a while. All right. Do your brokers specialize in specific states? Not really. All of our agents are licensed. Now, let me back up and say this. Most of our agents are licensed in 50 states, all of them. Okay. And we have some that are licensed in 46 states. There's 4 states around the country that are, frankly, kind of a pain to do business with, okay? But we write in all of those states. So when you say specific, all of my agents, all of them know the rules in every single state. We have a map. So when you call in and you're from Wyoming, you call in and you're from Tennessee, we know exactly what is going on in your state, the state-specific rules, the carriers that write in those areas. So we just have it, organized very, very well. So they don't have to specialize in a specific state because we know very quickly at a glance what is going on in that state. And again, we're a large broker. We write all over the country every day, writing plans, and so we can help you in any state that you're in. All right, I'm on workers' comp. I need to pay my insurance premiums to the employer. Since I have not been able to work since February, I plan to retire in November 2025. Please advise if I should take Medicare. Okay. So if you haven't been able to work since February, the bottom line is if you retire, you have to go on Medicare. The only people that don't have to go on Medicare are those that are going to keep working or their spouse is going to keep working and you're covered by an employer-provided plan that has 20 employees on the payroll or more, okay? That group doesn't have to go on Medicare, but it sounds like, Wanda, in your situation, you are going to go on Medicare at 65. And I would recommend that you start your 65th birth month. So if you're going to retire and turn 65 in November of this year, back up the clock about 2 to 3 months beforehand and do your Medicare enrollment. Now, if you're on workers' comp as well as disability, then you're going to be automatically enrolled into Medicare either on the 25th month of receiving your checks or you'll get your card about 100 days prior to your 65th birth month. All right, so yes, you should go on Medicare for sure. 65th birth month, but do it in advance, okay? All righty, Kenneth, my wife turned 65, 6/23/25. She's already applied for Medicare. Will she be covered on 6/1 by Medicare? Yes, we're always covered on the first day of our birth month. Okay, so in her example, yes, she starts June 1. Now, here's the exception, folks. Let's say, Kenneth, your wife turned 65 June 1. Then her Medicare would start in May. If you're born on the 1st, they always move you to the previous month. But if I'm born on the 2nd day thereafter, any day of the month after the 1st, I'll always start my birth month. Okay, so yes, 6/1. She'll begin A and B. Okay, let's keep going. Tim, if I work past 70, is there an age where you are required to start taking Part B? I like my employer insurance and would prefer to keep it if not required to start Part B. No, there is no age requirement for Part B. The only age requirement would be for Part A, and that would be for anyone that's taking Social Security. So if you start taking your Social Security at age 70, you're going to decline Part B, but they're going to enroll you into Part A. So that's the only thing that you'd be required. When we're on Social Security, we have to take Part A. But we don't have to take Part B if we're still working or our spouse is 20 or more employees. So you are fine. Stay on the group plan, and you decide to retire. The most elderly people I put in Medicare to date was 79 and 83. The lady was 79, the man was 83. She just retired and went on Medicare for the first time. Now, she had A, but she didn't have B because she had a great group plan. So you can keep delaying. And frankly, folks, Medicare's glad for you to do that because they're not responsible for you. That's why they make it so easy for you to come into Medicare at a later date. Just make sure, Tim, that there's no gaps in employment or active employment insurance all the way back to 65, and you can come in later. No penalties, no problems.
Okay, that's it.
Okay. All right. That's all we have, folks. Thanks so much. Enjoyed having you. Next Monday, 5 o'clock, I have an event we call Medicare Monday, where we do something very similar. Take questions in the chat, give you some more information about Medicare, but we're delighted that you joined us. Please give us a call. If we can help you in any way, we'd be privileged and delighted to serve as your broker. Have a good evening.